the Democratic Alliance says the party has developed its own COVID-19 plan because government's one is not working. The party says the National Command Council's COVID-19 response had failed to reduce transmissions. The DA intends to share its plan with the President. To tell us more about this plan and what it involves, we're now joined on the line by DA leader John Steenhuisen. A very good morning to you, and thank you for your time. You've been very critical of the manner in which government has been handling the coronavirus pandemic and drafted your own plan. Talk us through the significant differences from your plan to what government's been putting on the table.
Well, what we are focusing on is making sure that we're able to prevent the transmission of the virus and to keep people safe, and to ensure that we're able to ensure that, given the fact that government has lost control of the treatment and the prevention of the virus, that we start to prepare in a far more coordinated and organized way the healthcare response to ensure that those South Africans who now need medical attention or medical care as a result of the virus are able to receive it. It's very clear that the hard lockdown that South Africa has been through, which has come at a huge cost for many, many South Africans, has not yielded the preparations that it should have. In that time, they should have been building field hospitals and the like. So what our plan does is focus on 10 key areas that will allow government to exit this particular crisis in a way that saves more lives and livelihoods and ensures that every South African that needs or requires a hospital bed is able to get it. It should outrage every South African that we're now sitting after one of the longest, hardest lockdowns with hospitals without sufficient oxygen, without significantly capacitated field hospitals in many of the provinces. And our plan sets out very clearly how those provinces could urgently set about doing that and how we could start to partner with the private sector. The public sector is managing only 13,000 tests per day. That's nowhere near what's required to manage a testing and tracing capability. The turnaround times in the public laboratories is not good enough. It's taking far too long for people to get test results back, which makes combating hotspots and the like very, very difficult. So the private sector is testing at up to 3 to 4 times what the public sector is. And what we're calling for is a unified approach between the public and private sector to coordinate the testing, tracing and tracking initiative. It's time now for government to enlist the assistance of the private sector and also to put its money where its mouth is. We're going to borrow 700 billion rand this year. Of that, only 2.9 billion is going to the health response, 16.4 billion to bailing out South African airways. And this in a time when people need hospital beds and oxygen cylinders. It's time for government to reprioritize the funding and to ensure that we build equipment and procure healthcare responses that the people actually need, not scooters, not digging graves, focusing on saving lives and livelihoods.
And just drawing from some of the experiences from the Western Cape, which is where you govern as a party, what are some of those pivotal lessons that you've learnt out of that? And perhaps talk us through on what could have been done better there as you present these new solutions to help save the country.
We were very lucky to have learnt a lot of lessons in the Western Cape, and the truth of the matter is, and you can see from the footage that's being displayed on your screens right now, what a proper field hospital should look like, not the Bradlows and Furniture City Potemkin villages that are being set up in other provinces. So what you are required to do is to ensure that you have field hospitals so that your health system is not overwhelmed. And that is key to the strategy. So apart from the CTICC, there are now field hospitals in Khayelitsha, in Sonstraal, and in Brackenfell. And it now looks like even all those facilities won't be required. But there's no field hospital that would be wasted, particularly in provinces like Gauteng, and they need to urgently move towards that. And then making sure that you're spending your money where it is needed most. There is enough oxygen capacity from the oxygen manufacturing industry in South Africa to make sure that every hospital or every field hospital that requires oxygen is able to receive it. We believe it should be centrally procured so that you're able to ensure that it is effectively distributed and cutting out the opportunities for the corruption and maladministration that we've seen characterize so much of the COVID response over the last 3 months. And then, of course, making sure that you budget sufficiently in your provincial health budget. So that means cutting back. The Western Cape government in this year alone will spend 5 billion rand of its provincial budget on the COVID response. And that obviously means that you've got to cut from other projects and make sure that you're redirecting that money to saving lives and livelihoods to ensure that we can get as many South Africans as possible through this virus and start to rebuild thereafter.
Field hospitals have been built. I mean, I hear you being very critical there about the quality of the field hospitals, taking a jab at some of them and the infrastructure that's within it. We know that Gauteng Health MEC, Dr. Bandile Masuku, as well as Health MEC, Health Ministers, William Kize, have been speaking about the long-term plans when it comes to field hospitals, saying that they want these hospitals to remain, the field hospitals to remain there on a permanent basis. So they're working to ensure that these structures become permanent structures in the long term. So I'm not really understanding, as you speak about the low quality of the equipment within the field hospitals. Just give us more clarity there, and also a broader understanding on how your plan is much more different from what government is presenting on a day-to-day basis. And you also speak about the facilities that need to be added, and we know that ministers have been working hard around the clock, as the Netherlands has now donated COVID-19 test solutions to South Africa to help in the fight against COVID-19.
So I think that it would have been very useful if you could present some of the field hospitals from Gauteng as you present here, because those are not field hospitals. What they are beds. And what you require in those field hospitals is oxygen. You require proper sanitation, but most importantly, you require personnel. You can procure as many ventilators as you want. If you don't have the personnel, trained people who are able to intubate patients, that equipment is completely useless. So what we've been able to do in the Western Cape is procure over 400 extra healthcare professionals with 2,000 trained professional volunteers on standby around the country to be able to assist. It's not going to be possible to make these field hospitals permanent. I'm not sure what NASREC or an international convention center would think about having to be transformed into a hospital. These are temporary measures that are required now. We shouldn't be worrying about long-term plans. We can get to that. The priority now must be saving as many South Africans as possible and ensuring that every South African, regardless of where they are in the country, is able to access a hospital bed and receive oxygen and medical treatment where required. And that should be the focus. The crisis is upon us. The president himself admitted it. He said the storm is upon us. We knew the storm was coming. We've had 3 months to prepare, and it should be really angering to many South Africans that we're now scrabbling for oxygen cylinders and only now starting to finalize construction of field hospitals, or in some instances, in some provinces, begin construction of field hospitals in the midst of the storm. What has been done in the last 3 months? And I think that's a question that we should be asking. We will get through the COVID virus, but what we've got to do is get as many South Africans as possible safely over this particular crisis to ensure that we can start to rebuild the economy and our lives as we knew it in the future.
Okay, thank you so much for your time. We're going to have to leave it there for now. The DA is John Steenhuisen there presenting a COVID-19 action plan.